So welcome back everybody. In this next video in the series, we're going to be talking about treatment options for otitis externa. So I just want to touch on the different phases of treatment. We know that otitis is complex and multifactorial, but at its heart it is simply a progressive inflammatory process. And we can simplify our treatment into two main phases. The first stage is looking to achieve remission. So we're treating the secondary infection and we're trying to reverse the inflammatory changes. The second phase is maintaining remission, and this is often what gets missed. I bet you'll all see cases of otitis that keep coming back. So the dog periodically will come back with another ear problem. And in many of those cases, we're missing our maintenance phase. Our treatment options can then be further broken down into ear cleaning, antimicrobials, anti-inflammatories, and pain relief. So let's take a look at these. So why do we clean ears? We know that increased cerumen or discharge and biofilm, if present, will trap bacteria and prevent medication from working. So an ear flush may well be indicated, particularly in purulent or suppurative otitis cases. Now, it's important to communicate with owners that ear flushes are not curative. They may need to happen multiple times. The purpose is to get the ear really clean and allow us to assess the full ear canal and eardrum. They must be carried out under general anaesthetic. I have seen a lot of ear flushes carried out under sedation, for example, Dom and Torb is a commonly used combination, and this just isn't enough for two reasons. One is that we do need to protect the airway, that's really important, so we would anaesthetise and use an ET tube. But also these ears are very painful. My ear flushes here at Langford would have methadone as a pre-med, often paracetamol as well, and then many of them require either ketamine or fentanyl, and sometimes we'll use local blocks. Some very painful ears will have a combination of these, so I hope this just goes to show that actually just sedating the dog isn't going to be enough, and it's going to make your life a lot harder as a vet as well, and your nurses, because the dog won't settle. The dog won't want to stay asleep, the dog will be shaking its head and reacting. So I would urge you to just remember that general anaesthetic is going to be preferable. And we would use saline, this is not ototoxic. And we would usually use a 4 or 5 French urinary catheter, and you can pop that down the normal otoscope. We're very lucky here, we do have our big video scope, and some of you may have a video scope in practice, which I would urge you to play with. But if you've got a normal otoscope, you can pop the catheter down it, and we're just looking really to flush until the ear is clean. Now, ear cleaning at home I think is important to talk about. It can be very useful. So if I have a really purulent Pseudomonas infection, I would ask the owner typically to start off cleaning once a day. I see a lot of dogs having a lot of cleaning at home, and this is actually counterproductive. So maintenance cleaning will come back to, but is typically not required. Twice a day, I would argue, is too much. Now, how often to clean is very subjective, but what we don't want to do is make the ear very wet and macerated and ulcerated. And sometimes even once a day is too much. Typically, once a day is a good starting point, but for some dogs every other day or twice a week is enough. And it's important to consider the type and volume of discharge. If you have a very ceruminous otitis, so it's normal wax, it's just an increased amount, then we might benefit from a squalene-based cleaner. Now, Otoact is an example, there are plenty of others, but this will typically be better at softening the wax. If we have a purulent or a suppurative otitis, then something water-based, perhaps with antibacterial action, or Triz-EGTA can be really helpful. So Otidine is another example I use a lot. It doesn't sting, it's safe if the eardrum's not intact, and it contains a low amount of chlorhexidine and Triz. So it's a really nice cleaner for these purulent ears. Now on to antimicrobials. We've already talked in the last video about how we're going to be guided by cytology, not culture. And we're going to review our cytology every 2 to 3 weeks, or a suitable interval discussed with the owner, until the cytology is clear. We're going to use topical therapy, unless we've got some otitis media, or if the owner is not able to touch or handle the dog. This unfortunately does happen. Now, there was a study that came out recently, and I'll link that later on. If we just have an erythroceruminous otitis, so a red waxy ear, perhaps with a little dysbiosis of cocci and or malassezia. This study found that topical steroid alone was enough to normalise this. So we might use some cortotic, for example, and again we'll come back to that, to normalise this. We may not need any medicated drops at all. In those cases, I may not introduce a lot of cleaning either, because if the ear is quite dry and it's just a little red and waxy, we don't want to make the ear really wet. So you may want to give the ear a clean at the beginning of treatment, but I probably wouldn't be encouraging the owner to do lots of cleaning at home. And then we're going to be thinking about our first line agents, so if we've got cocci and or malassezia. And this includes things like gentamicin, so Otimax and Exotic, polymyxin B, so our Surulans and our Remix, and our florfenicol in Neptra. It's worth noting that all of these are ototoxic if the eardrum's not intact, and Neptra especially I would urge you to be cautious with. We have seen cases of dry eye induced by Neptra with a ruptured eardrum. Neptra is very helpful when we have a dog that's very head shy and the owners can't put treatment in at home. However, if we have any doubts about the eardrum, we should be at least sedating, if not anaesthetising that dog, to clean the ear and or flush the ear and check the eardrum. If the eardrum is ruptured, I would not feel comfortable or recommend putting a Neptra in there because there is a risk of ototoxicity. And then I would request that we reserve our fluoroquinolones for rods. Something like a Rhizon is a very nice first choice for Pseudomonas. It's a licensed ear prep. Now, it's not licensed for use if the eardrum is ruptured. However, it is considered safe. So when we've got rod bacteria, even if we've got a ruptured eardrum, starting off with an Rhizon is quite a sensible first step. But I wouldn't be using a Rhizon for cocci or malassezia. And so our anti-inflammatories. Now, steroids are essential for most, if not all, cases of otitis. Most of them benefit from a course of oral steroids, and that's because we've already talked about our perpetuating changes. We know we get these changes that help drive the infection, and that's what the steroids are going to help to reverse for us. They're going to open the ear canal, reduce the redness, reduce the inflammation, reduce the hyperplasia of the glands in the ear. So the length and dose will be a little guided by the patient and the severity. If this was a very slightly red ear, for example, in a young healthy dog, I might just give 5 days, for example, of an anti-inflammatory dose. If this was actually quite a chronic, horrible looking ear, again in a dog that was healthy with no other problems, then I might give a couple of weeks of once daily, 0.5 to 0.7 mg per kg, and then taper over the next couple of weeks. So the length and the dose depends a little bit on the severity of the ear. And of course, remember with steroids, we must make sure there are no other medications being given that are a problem, and the dog doesn't have any comorbidities that will contraindications why we can't give steroids. We've talked a little bit about our topical steroids. We have Resicort, which contains triamcinolone and salicylic acid. We have Cortotic, and then we have Cortavance, and both of those contain hydrocortisone acetonate. None of them are okay if the eardrum is intact, but all of them can be very helpful to resolve a mild dysbiosis like we've already talked about, and then also for maintenance. And then analgesia, I've touched on this already, but remember the ears are very painful. There's not a lot of point giving NSAID because, as we've said, most of these dogs need steroids. So I would typically use a Pardale at 10 to 20 mg per kg every 8 to 12 hours, depending on the dog, the comfort levels. And I might add in some gabapentin if needed. Many owners will say that their dog's not painful, and I think it's that the dog masks very well. Think how many Labradors and Spaniels we see who are acting completely normally. But I would always encourage them to trial some pain relief. And if they really see no difference, then we don't have to make them continue. But it's amazing how many owners will say the dog is doing much better once we've resolved the infection. And then we've already talked briefly about this, our maintenance steroids. Now, one of my lecturers used to say to me, remember the underlying problem. And at the time, I didn't really know what this meant, but I would like to break it down into a couple of points. So diet trials, really helpful if we have other signs of allergic disease, but I may not do it alone if I've just got ears, because if the dog has lots of perpetuating changes, it's unlikely that the diet trial will make a difference. And if the dog only has a flare-up every 3 to 6 months, again, we may not have an ear flare-up during the diet trial. So I don't tend to diet trial if it's only ears. Similarly, immunotherapy can be very helpful, but it may not be enough on its own with ears, because we have to give it for at least 12 months to know if it's going to be helpful. So then what does it mean, don't forget the underlying cause? Well, what I've come to realise that means is, don't forget we need to maintain the ears. So that's the second phase of treatment we talked about. These ears are going to flare up again if we don't introduce some maintenance therapy. I've included there the paper looking at the topical steroid use, and I've included there the details. So we would typically use 0.4 mils or 2 pumps of cortotic once a day for a week if needed, and then go on to twice a week. And remember, the eardrum needs to be intact. Okay, so in the next video, we're going to be talking through a case example and putting all of this together. Please join us next time.